The path that you take, every day is a different choice.
I have done so many horrible things to like so many people that I love.
In my head, I knew I was pregnant.
I was afraid of judgment, afraid of what everybody's going to think, that I'm having another baby after everything that I've done. How can I take care of another baby? I can't even take care of myself.
I've stolen and lied and manipulated the people that care about me the most.
I looked at it and it said positive. Oh, and my whole world just shattered.
Alpena County is nestled on the shores of Lake Huron's Thunder Bay in northeast Lower Michigan. The area is a popular vacation destination and is home to the Thunder Bay National Marine Sanctuary. But there is a troubling undercurrent in this part of the state, a high rate of babies born to drug-addicted mothers. In 2015, a group of concerned community leaders decided it was time to do something about it. It was time to save these babies. It was time to tell this story.
It is a growing problem here in northern Michigan, and we see that in the development of neonatal intensive care response. In our hospitals, there's more and more neonatal intensive care needed and developed in response to the reality of the increasing problem of drug addiction and babies born addicted to drugs.
Withdrawing so completely bad, I lost 7 pounds from the night that I went in until the next morning. Continuously getting sick. I spent probably 6 hours of it inside the shower, crying and laying on the floor of the shower. I mean, I couldn't move. I was so sick. I brought a sweatshirt and a big comforter out into the middle of the yard on a 90-degree day in front of everybody at the treatment center, covered up in a blanket, sweating, and thought I was freezing. If anybody asked if I was okay, I told them I was dying, because I was convinced I was dying.
The symptoms they show us are the inconsolable cry, difficulty feeding even though they have frantic sucking. They may be scratching their faces, their muscle tone, they're fisted and their hands are tight together. And even with holding, to comfort, they're agitated, and that's very serious. And we have a scoring system, the Finnegan scoring system, which is used by most centers that treat babies to give us an idea of when we have to treat them. So we initially try to put them in an environment that's quiet, less light, gentle handling.
NAS affected 7 babies for every 1,000 admitted to a neonatal intensive care unit, or NICU, in the U.S. in 2004. That number jumped to 27 infants per 1,000 by 2013. In Michigan, 404 newborn babies were treated for NAS in 2010. By 2014, that number more than doubled to 815. The drug addiction epidemic is ruining lives, hurting babies, and tearing families apart.
When a mom is having a baby and the child presents with these issues, it is mandated by law that the hospital personnel report to the Department of Health and Human Services a problem, okay? And once they report that, then law enforcement and the courts get involved to respond to that child. Because indeed we have a duty, a society has a duty through its courts, through the Department of Health and Human Services, to respond to the child and to make sure the child is cared for. Initially there's a presumption that the child should be with the parent should be with the child. And if the child is in foster care as a result of being put at risk, That's a temporary situation initially. A plan is set up whereby there's reunification of the child with the parent, so the child is at less risk to return to the parent. But it's not open-ended. In other words, within so long of a period of time, depending upon the circumstances, the Department of Health and Human Services may seek to terminate the rights of that parent. The admonition to the parent is, get your stuff together quickly. The law is not patient in this regard because the child is entitled to permanency. And that means your parental rights are terminated. And the implication of that is that it's forever. You'll never see that child again. Permanency for the child means a healthy, happy, permanent situation where they're raised in a healthy, happy, not perfect, but a permanent situation for the rest of their childhood, something that they can count on for the rest of their life, something that they can take into their future and say, I want my children to have the same childhood I had. That's their right.
I think there's a certain segment of the population of moms that are pregnant that don't want to share or seek help because they're fearful of losing their child. But what they have to realize is that when that child is born, and if there's a positive test that that child is addicted to some substances, they're running a high risk of that child being removed from their care. So it's vitally important they recognize that if they do have a problem to begin with, they should seek help immediately, early on in the pregnancy, so it doesn't do further damage to the child.
While addicted to heroin, Ashley gave birth to a baby girl diagnosed with NAS. Due to her untreated substance abuse, she eventually lost parental rights to the baby and her 4-year-old son.
A cop pulls into the driveway, and a van pulls into the driveway, and they come to the door, and I had this bad feeling that it's for me. It's got to be for me. Nobody else has done anything. And they said they're here for my son. Well, in the meantime, we can't find my son. My son is hiding. Because he knew at 4 years old that they were there for him. He knew. Went looking through the house. He was hiding in the bathroom behind the toilet. And I had to drag him out. The CPS worker and the cop said, if you're not going to do it, then we are. You have to. You have to take it. So I had to drag him out. And he's yelling, no, don't let me go, Mom. And I knew I had to. I had to drag him out and put him inside this van of these people that I don't know. And telling him that I'll see him soon. I gotta go take care of his sister. He was just crying and screaming and did not want to go. And they took him and told me I wasn't allowed to find out where he was going until I had court and we figure out where he's being placed. I have a mother who is also an addict and started smoking marijuana with her at 13. That was the open gate, the marijuana. And I never thought of it until I got clean, but that's where it all started.
Sadly, Ashley will unlikely see her son and daughter again. It's tragic, and it begins with a tale of drug addiction.
When I was 15, I just started to experiment with different weed, Xanax, pills, and then I got with a boyfriend who liked to do a lot of Vicodin, and that's when I started.
From there, wasn't long after, I think I was about 15 years old, when I tried crack cocaine for the first time.
That turned it into Oxycontin, and then like Lortab. A friend of mine I worked with, she used heroin. And I always thought heroin was like the stigma of like somebody who's knotted out, you know, passed out with a needle in their arm. can't function. I wasn't scared of heroin anymore. I never wanted to try heroin because I thought I would be that person, but she wasn't. So I tried it with her, and I never stopped.
I tried heroin for the first time. My younger sister and my mother were into it. That high was the ultimate high that I looked for my whole life that I never found. From there, it was every day. I never stopped.
So for all you moms out there that might be struggling with pain addiction, know that we're here to help you. We want to help you. Our job is not to judge you, but we need you to be honest so that we can make sure that you and your baby get the best care possible.
What I would like to say to you as a mom who's either about to have a baby or just recently had a baby, the roads, the paths that you take, every day is a different choice. I know what's going on in your life as far as there are a lot of different variables for why maybe you started taking drugs or for whatever pain, but there are alternatives. There are a lot of people out in the community that can help you, and it's not just you anymore. Now it's your baby, and your baby has to live with the consequences. He didn't have a choice. That baby didn't have a choice. That baby is the choices that you are making to move forward, to give the baby the help, and in giving the baby the help, you need to be able to give yourself the help.
Services for women who are opiate dependent in Northern Michigan, treatment services, we have some resources available. And so it should never be a case that someone doesn't have an option. We also offer counseling services, we offer case management and nursing support services, and we coordinate really closely with a woman's OB.
What I will say to you is, you're in treatment, I want you to continue your treatment. Make sure your baby's growing well, make sure your nutrition is good. Don't listen to anybody who tells you to stop your medication if you're in treatment, to increase your medication, decrease your medication. Listen to your doctor who's managing you. Continue with your counseling. Don't smoke cigarettes, because tobacco makes everything worse. If you're smoking now, you need to get rid of it. You know, that you can wean, that you can get rid of. And make sure you are open with your closest support people, whether that's family or friends who understand you. Don't be afraid to take your medicine, even though it has an implication that somehow you're a bad person. You're not a bad person if you want to take care of your baby. You really need to do that.
As more becomes known about NAS and its rapid rise, there is a growing recognition that a coordinated approach is needed to help stem the tide.
Some level of collaboration between the Department of Health and Human Services, the courts. There has to be greater collaboration with community mental health and law enforcement. If we work together, toward the same end, it'll be much more effective.
I want to make sure, the moms get the help they need. That obviously means they need health insurance to provide them with the medications that keep them, under control for their addiction. And that's an insurance issue, that's a state issue, a public health issue. We have to make sure that their addiction is treated like a chronic medical condition. In other words, if I have high blood pressure and I get medicine for high blood pressure and it's better in a year, nobody's going to stop my medication. And a mom who's being treated for addiction maybe needs medicine for 2 years or 5 years or longer, with her counseling and with her support. So that's a very important thing, I think, for medical professionals and our politicians and our public health people and our insurance people. They need to know that about treating this.
Well, the way the medication-assisted treatment works, which I think is probably helpful for folks, because I hear, oh, it's just replacing one drug for another. And the way that Suboxone, Subutex, or Methadone work, when prescribed or ordered appropriately, they're at a level that the person does not get high. But it removes their craving and their withdrawal symptoms. If you think of addiction as not just physical dependence on a medication, it's all the other issues that go along with the criteria. So if I think about it as a plate, and I have all these things, broken relationships, different attitudes, behaviors, that all make up my addiction. And one of those pieces on the plate is my physical dependence and the fear of going through withdrawal. If we can provide a medication that doesn't have the person get high, but takes that off the plate for right now, and then we can work with them with counseling and recovery support.
In Kalamazoo, Michigan, a comprehensive program is addressing coordinated care for NAS babies and their mothers. The Kalamazoo NAS Prevention and Treatment Program.
As the project coordinator, I had the ability to work with all of our partners. So I worked with both of our local hospitals, with the social workers in the hospitals, and I worked here at Victory Clinic with their staff and the moms who were pregnant or who had just given birth that were getting methadone treatment. And we really tried to listen to what everybody needed in order to make services better in our county. We listened to the moms and what they wanted or needed and how things hadn't been so great in the past. We worked with neonatologists, the social workers, pediatricians, and OBGYNs, the methadone clinic. And we also worked with our local Department of Health and Human Services, with the Child Protective Services, help make sure that they were doing their best to help babies and families be successful. There's a lot of nationwide focus on opioid and opiate dependence and addiction. There was a lot of enthusiasm and excitement about kind of targeting this issue and really trying to do what we could to make Kalamazoo a better place and a more supportive place for families dealing with opioid dependence. Inviting them to the table then allowed everybody to feel like they were a part of the solution and they had a voice. We brought a tool that we were trying to use to help providers understand how to engage, and the moms went through it and gave feedback like, we just want people to talk to us like we're people, and we know we've made mistakes. We don't need somebody to tell us that same thing. And so, we added quotes straight from them to this so that service providers could understand how they were feeling and what they were really looking for that would kind of keep them engaged or get them engaged.
I just bought a dollar store pregnancy test. I just said, I keep having this feeling, and I have a child, so I do know, what it feels like. I came home, and I think I actually went to the bathroom to use. So I went and I set it down in the back of the toilet, and I didn't even check it. And the next time I came into the bathroom, I looked at it, and it said positive. Oh, and my whole world just shattered. I thought I could do it myself. At first I thought I'll just get an abortion. I'm already using. I don't, this baby is, I didn't know anything about opiate abuse in babies. So I thought I'll just get rid of it. So I thought I could stop by just aborting or but I think once you have a child, I don't think it's so easy.
So there are a couple ways that as a mom that you can go into a situation like this if you have an addiction or you have a dependence with opiates and opioids. You can try to hide it. You can avoid your doctor's office, and then you end up in the delivery room and they probably test your baby for opiates and opioids. The baby goes through withdrawal, protective services can get called, and you can feel like you don't have any control over the situation.
Because I had no idea what can happen to that baby. I knew there was a good chance that I could get my kids taken. I didn't know how much danger it was to that baby. And you tend to ignore those kind of things. I wish I would have known how much pain my daughter was going to go through the second she was born, how much she had to go through. She had to go through withdrawals the second she was born, and withdrawals are the hardest thing I've had to do in my life.
Or you can talk to your doctor or a social worker, or you can call a substance abuse hotline in order to get treatment, and you can go in knowing that you have people who are going to advocate for you and your child, you can know that you're already taking the right steps and doing the right things that are going to make it better for you and your baby when you deliver. And that way, you're the one in control of what happens, and you can create your own destiny.
I called the nearest rehab. I literally just got up, I grabbed a cigarette, and I went to the porch, and I grabbed the phone book, and I just flipped to the nearest rehab I could find. And I called them, and I just said, I'm pregnant. I hadn't even gone to the doctor yet. That's how unreal I didn't want it to be real. And immediately, they batched me over to the Victory Clinic, and they told me, you know, it's okay. They were completely understanding, completely welcoming. So they got me in the next day. That was scary. I always picked, the reason why I didn't want to tell anybody, I didn't even tell the father of my child that I was shooting. It was so embarrassing, and I didn't want anybody to think, wow, you know, you think when you hear that, you're like, wow, she must not care about her kids, or she must not, how could she do that to her baby? And that wasn't it at all. I would never. It was just, I was so scared to tell people. It was almost like they were happy to see me. I thought that when I got there, it was gonna be, you know, we're gonna call CPS, and you know, we're gonna take away your 2-year-old. We're gonna, you know, you're gonna lose this one, and it wasn't like that at all. Not one bit. So it completely flipped my world when I came in here, and they were all so happy and so willing to help me. I had my son in September. He weighed 6 pounds, 14 ounces. He was 20 inches long. He was perfect. He was fine. We stayed in the hospital for about a month.
People have lost relationships. They have lost self-confidence. They may not feel like anyone has their back. And one of the things that we really work hard at here is to make sure that folks know that there's someplace safe, that someone has their back, and that we believe in them. And we let folks know that how proud we are, that every step forward, we recognize that there will be steps backwards, but we watch people make those steps forward, and we realize what it takes to do that. Recovery is a wonderful thing, and it brings so much joy. And it may not seem like it today when you're in the throes of addiction. We believe that everybody has a right to the opportunity for recovery.
Ashley is now in recovery, and her 3rd child was born healthy. Mom and baby are thriving.
I want to go farther with this. I want to do a lot of motivational speaking, and I want to be able to help. I want to be able to be the voice of hope. We all deserve a second chance. I am proud that I have a story that can help people, and I'm not hiding anymore. They're stories, not secrets. I have a long future ahead of me now.
You can't do anything about yesterday. You can't do anything about this whole month before us. You just can't do anything about your past and anything you've done in it. But you can do something about today, and you can do something about tomorrow. Don't dwell on what you have done. Start worrying about what you're gonna do.
If you are pregnant and addicted, call now for help. 1-800-834-3393 or visit nmre.org.
It's sad in this day and age, people don't understand about drugs and alcohol and tobacco when you're in pregnancy.
Well, we are hoping that even just one person that is born that is not addicted to drugs or alcohol being saved is worth it.
There is opportunities for recovery for you. There is support out there.
you're embarrassed, but to them, they see somebody who is pregnant and getting help. They see somebody that was using but doesn't want to use anymore. And that makes people happy. It makes yourself happy. You know, they're really here to help you, you know, move forward, get healthy, get better.
That child is entitled to permanency for the rest of your life, for the rest of their life.
Ask yourself what kind of future you want for yourself and your unborn child.